Hi, I'm Dr. John Parker. I want to take the time to personally invite you to a very important seminar we have coming up where we talk about the causes for thyroid disorders, adrenal fatigue, hypothyroidism, hormonal imbalances, brain fog, constipation, why do you have problems with hair falling out, and low energy and libido. When we're going to go over in our seminar is the reasons why you're having this problem. We have a systematic approach in our office that combines therapies, it combines testing, it combines energy point muscle testing. We're going to go through the whole gamut of what we do to fix your chronic health problem. Let's face it, folks, I know that you have a chronic health condition that's not getting better because in our healthcare system, it's horrible in fixing those kind of problems. We have a great holistic approach. I want to personally invite you where you can come into our office, get to meet us, and get some valuable information on what you can do to fix your health problem. Next, I want you to watch this short 4-minute case review success story, and then I want you to call and schedule to come in for your seminar that's up and coming. Thank you very much. This is one of my most awesome patients. This is Stacy. She's been coming to see me for 3 months, I believe, and we're just going to share with you how she's doing now. But first, I want to start with what was going on when you came to see me.
I originally came because I was told I had Hashimoto's, and I was feeling awful, very tired, no motivation, no energy, and needed to lose quite a few pounds also.
And the day you were just kind of drug out at work and you just weren't functioning well.
Yes.
And so we looked at some of your tests. We ran a more extensive lab. We looked at some different markers on your blood work, and then we started working with you. So how are you doing now?
I'm doing much better now. As of last Friday, in 11 weeks, I've lost 28 pounds. Taking all the supplements that you have recommended, doing the Rife therapy, doing the foot detox, the emotional release therapy, and the field control testing, and I've followed the regimen very strictly, and it works.
Yes, it's amazing how well it works when you find things like we worked on some scar points, and we did some basic emotional release techniques. We all have different things. We worked on getting you some more energy. We looked at some adrenal rhythms and adrenal levels, and did some food sensitivity tests, and we cleaned out the gut, and we changed your diet. And
yes,
you know what's cool about it is when people start getting some energy, starting to feel better, how quickly things start being able to do very easily to get the goals they want for their health. Was any of it real hard to do?
No, just in the beginning. It's a little
Yeah.
hard to get started, but if you are determined to do it, you can do anything you put your mind to, and it's very well worth it because I feel great now.
Yeah, there's been a huge change with you. I love taking care of you. It's such a reward to do this kind of work and see people who dedicate themselves to getting healthier. I look forward to seeing you some in the future, and would you mind if I share this with others?
Nope, not at all. Come
right.
see Dr. Parker.
Thank you, that's awesome. Appreciate that.
Okay, so this is Mrs. Stefina Rojas. Stefina, you came to our office about 6 weeks ago.
Yeah.
Stefina, what type of problems were you having at that point?
It was a little bit of everything. I had I have severe chronic fatigue, headaches all the time. I couldn't focus. Very irritable, like anything just would tick me off. Very irritable at things that just stupid things. And just didn't really want to do much just because of the fatigue. I just didn't get much done around the house, but I could tell that it was just getting progressively worse.
Okay, and when we saw your blood work findings, we definitely confirmed that you were autoimmune thyroid, that you had some antibodies against your thyroid.
Right.
We also found that you had an underlying virus as well. And then we also found that you were in pretty much complete adrenal fatigue, which also manifested with your blood sugar, so it was affecting your blood sugar regulation. So hence a lot of fatigue, a lot of headaches, a lot of kind of just wanting to sleep most of the time, right?
All the time, yes.
Definitely. And so how do you feel you've done over the past 6 weeks? What's changed for you?
Well, a lot. I feel amazing. I'm getting things done around the house that I wasn't getting done. Like I said, I just went and cleaned my outside windows. I just cleaned my closet yesterday. Whereas usually
Wow.
I honestly would be taking like a 2-hour nap just because I had no desire. I just couldn't do anything just because of the fatigue. So just that alone, I feel better. And some friends don't even know that I'm actually, you know, seeking treatment, and they're saying I look better, my skin looks better.
That's great.
And I think that I remember just waking up and my face would be bloated, and I just didn't understand why. But I don't have that bloating anymore, and I just think overall it's just been an awesome progression just in the few
Just a
weeks
short
I've
period of
been here.
time, even.
Yes.
Yeah. So, how do you feel this approach was different, maybe, than some of the other experiences you had?
Just the fact that you know, you took the time out, you asked a lot of questions and just tested me in different ways, and just everything that you said made sense, just in other aspects. Just history, you've kind of brought out some things that I didn't tell you, that history it coincided, so that just made me believe more and have more confidence in you, and I feel amazing, and I am telling people, my friends and family, about you already.
Oh, great,
Yes.
great. Well,
I'm
we
already
appreciate
referring
that.
you.
Thank you. We appreciate that. And of course, we have more work to do. You know,
Yes.
we're finding some things
Yes.
that we need to address. But just in our short, 6 weeks time, I'm really happy with your progress. And I really look forward to seeing you, at the end of our 4-month plan here, as far as your progression and what changes with you.
I'm excited because everything that I've seen thus far is just amazing. I can't wait to be done, and I know I'm going to feel way better than I feel now, but I do feel really good right now. So
Great. I look forward to seeing you improve, okay?
Thank you.
All right. Thank you for sharing your story.
Mhm.